When part of the inside of the body pushes through a weakness in the surrounding tissue or muscle wall, it can cause a bulge under the skin, and this is called a hernia. Hernias are usually found in the abdomen. The most commonly found is an inguinal hernia, where part of the bowel pushes through a weakness in the groin called the inguinal canal. In the man, this is a passageway from the abdomen to the scrotum. Inguinal hernias mostly affect men and are increasingly more common the older you get. However, hernias can also occur in women. Untreated hernias may get bigger and more painful with time, especially with heavy lifting. Eventually, the muscles around the hernia may become so tight that the blood supply to the tissues inside the hernia is cut off. This is known as strangulation and requires emergency surgery. Hernia treatment usually involves some form of operation, either open surgery under local anaesthetic or keyhole surgery under general anaesthetic. These are both options with various pros and cons for each. In open surgery, an incision is made in the groin under local anaesthetic, avoiding a general anaesthetic, and the bulge is pushed back through the weak spot, and then the muscle is reinforced with a mesh patch. In keyhole surgery, also called laparoscopic surgery, much smaller cuts are used, with special instruments used to repair the hernia. The mesh in this case is placed behind the muscular wall of the abdomen, but in front of the lining on the inside of the abdomen called the peritoneum. This results in less risk of mesh infection or pain. The camera is inserted via a 12mm laparoscopic port. This is placed just below the belly button, and two 5mm instrument ports are placed below the laparoscopic port. In total, 3 incisions are made. The first step is to use a balloon to create a space between the lining of the peritoneum and the abdominal wall. This space is maintained with carbon dioxide and allows for instruments to be inserted in a 3-dimensional mesh, a light mesh, which is secured in place once the hernia has been removed with dissolvable staples, which take about 6 months to fully dissolve. The mesh needs to be adequately secured to the pubic tubercle to avoid a recurrence, taking great care to avoid the delicate structures of the inguinal cord, which include the spermatic cord and the blood supply and drainage to the testicle. After your surgery, avoid heavy lifting more than 10 kilos for the first 4 weeks to avoid a hernia recurrence. Remove the waterproof dressing yourself after 1 week and make an appointment with your surgeon after 2 to 6 weeks.